Here I would like to show MRI of the cervical spine in a 55-year-old with history of neck pain not resolving. So what I would like to show here is not about the degenerative changes in the disc lesions, but I would like you to concentrate at the atlantoaxial joint and the odontoid process. What we see here is a slightly more elongated odontoid process compared to the normal people. It does not have any significance as it does not have any basilar invagination or basilar impression. But more importantly, there is a transversely oriented low signal intensity line on both T1 and T2, and on the sagittal stud there is subtle increased signal intensity at this level. So these features are most likely to represent an undisplaced fracture of the odontoid process, which was clinically not evident or not presented clinically with acute injury. As the history is not of acute injury, so this is likely to be subacute or old fracture of the odontoid process, which is unfused. Differential would include a partially fused or unfused ossification center. The best thing is to correlate with any previous imaging. Fortunately, this patient had previous imaging about 3 years ago, and this region was completely normal. So hence the diagnosis is very clear here. So this is a subacute or old transverse fracture through the base of the odontoid process. This can be further confirmed with CT scan of the cervical spine and needs correlation with any past history of trauma. If there is no history of trauma, we need to look for any evidence of osteoporosis in this patient. This is unlikely to be of urgent surgical significance and but needs urgent clinical evaluation and proceed forward from there with CT of the cervical spine and if needed neurosurgical input.